So one of the things that we hear a lot about are how to manage the dressings after surgery, whether it's a hip or a knee replacement. So this is a short video to talk about how to do the dressings, and it's the same whether it's a hip or a knee. So we use multiple different layers of suture that are buried in the skin to close it, and we finish it with a surgical mesh and a glue, and then put this waterproof dressing over it. It looks like a big Band-Aid. And this dressing will come off at 1 week, and that's something that you'll take off. So we're gonna peel this off, and you start in the corner here, and you just slowly peel it. And you wanna be careful when you peel this off, because deep down underneath that is a surgical mesh. And when you see the mesh, you can put your finger on it and slowly peel in line with the incision to reveal the mesh down below. Now you take that off again at 1 week after surgery. And then the mesh will stay on for 2 to 3 weeks. But what will happen to the mesh is you'll see it starts to peel up along the edges. And when that happens, you can come in here and you can actually just trim it with your scissors. So if it starts to peel up, you can just take some scissors and trim it off. And when you trim it off, that will protect it. So when it comes time to take this dressing off, what you want to do is, again, you want to peel it off in line with the incision, and you want to use your finger to sort of support the skin, and you'll grab it and just slowly peel down, all the way down, and just keep working it. There's no rush, and this will peel right off. And once you peel it off, you're going to see the actual incision itself. It's not uncommon to get a little bit of bleeding where that incision is, because the dressing sometimes peels some of the scab off. That's totally normal. That will dry right up, and if that happens, you can just put a gauze over it with an ACE bandage and take it off the next day.